Good afternoon. This is Bryce, and you're listening to Generation RX Radio on 90.7 WCLH, Wilkes-Barre, Scranton, Hazleton. Keep it locked.
My name is Jamie, and with us here this week we have Dr. Danielle Keek, an assistant professor of pharmacy practice here at Wilkes University Nesbitt School of Pharmacy.
Hi, everyone. I'm Dr. Keek. Nice to meet you and be on this show today. I guess I can't meet you. I don't see you in person, but I'm really excited to be on this show today. I am an assistant professor of pharmacy practice at Wilkes University, and I have been a practicing pharmacist for a little over 3 years now. I do practice in the community pharmacy setting, so I get a lot of experience interacting with patients and getting to talk to them about all their different disease states. So I'm really excited to be talking about opioid use disorder and some of the different strategies that we can utilize in the community setting to help our patients.
Thank you for the introduction, Dr. Keek. Me and Jamie currently have the pleasure of having you in class, and we're really excited to have you on the show and for you to share some of your insight with us. We will always have a licensed pharmacist faculty member with us on the show to ensure accurate information goes out to you. We are here to bring you weekly topics centered around the opioid crisis, proper medication use, and disposal, in not just my community, your community, or our listeners' community, but it is all of our community. Be sure to tune in every Wednesday afternoon from 1 to 1:30 p.m. right here on 90.7 WCLH for new topics and discussions.
So before we get into this week's topics, we just wanted to do a quick recap of last week's topics. So last week we talked about what fentanyl is and how it's been such a problem recently, fentanyl testing strips, and we really talked a lot about COVID and mental health and how that has led to the rise in a lot of opioid deaths in the past year. And we wrapped up with a news article about a new safe injection site that was opened in New York City.
Yep, thanks for the recap, Jamie. And after last week's show, we thought it would be good to talk about some harm reduction techniques within the community pharmacy setting and how a community pharmacist is a resource. We touched a little bit on it last week with fentanyl testing strips and the safe injection site. And for those of you who don't know what harm reduction is the idea that drug use is a part of this world. And as healthcare workers, we need to be able to teach people and help people in a non-judgmental way. This includes things such as clean needle programs, having naloxone on hand in your pharmacy, and educating patients about medications for opioid use disorder. I know this sounds like a confusing topic, and some people might be like, whoa, are they saying it's okay to use drugs? But the whole idea behind harm reduction strategies is that if people use drugs, we want them to use them safely. Some of these harm reduction strategies we talk about today are designed to prevent overdoses and infections. So, Dr. Keek, could you tell us a little bit about why it is important to counsel patients on safe needle use and using clean needles?
Yes, I can. Thank you so much for that great introduction and a little bit of background about harm reduction. I think it's really important to, have that understanding that we're not condoning the use of opioids, but we're really just making sure that our patients are staying safe if they are going to use them. And one thing I want to emphasize is that opioid use disorder is a condition or a disease state, just like having diabetes or just like having hypertension. And we need to, try to get away from that stigma around opioid use disorder, like the patient is doing something wrong. It is a disease state and it is a condition. So we need to make sure that we're doing everything possible to help our patients and make sure that they're being safe. So I know working in the community setting, I originally was a technician, then an intern, then a pharmacist. So I've been in the community setting over 10 years, and I have been involved with safe needle programs and being able to get needles and syringes to patients so that we can, prevent that spread of any bloodborne diseases and keep our patients safe. So I think it's really important in the community setting to have these programs, especially in our community pharmacies, to allow our patients to be safe if they are using opioids or medications that are injected. So even though I think, like you said really nicely, Bryce, we don't want to necessarily, condone the use of it or say like it's okay to use it. I think it's important that we have these harm reduction strategies because an opioid use disorder really is a disease state, and we need to make sure we are helping these patients. And after giving them the needles, I think it's important that we give them other resources as well, so we can, refer them to providers or refer them to other community resources so that they can get the help that they need. So being a community pharmacist, I think not only having those safe needle programs, but trying to tie in other resources and referral of patients is really important.
Yeah, definitely. Thank you, Dr. Keek. And like you touched on, like the bloodborne diseases is something not a lot of people think about, but something that just handing out clean needles, like you could prevent the bloodborne diseases.
Yeah, those are some great points. So as Bryce said, naloxone is another way that another harm reduction strategy. So naloxone is the antidote for opioids, meaning that if you take naloxone, the effects of the opioid would be reversed. This is important in instances where someone takes too much of an opioid and experiences a breathing emergency. Naloxone can be administered as a nasal spray and is really easy to use. Bryce and I got trained last semester in how to use it in our care lab class. Naloxone, or patients taking opioids, or people who have a friend or family member on an opioid medication should have naloxone on hand in case of a breathing emergency. It is also effective in reversing a breathing emergency in people who overdose on heroin as well as fentanyl, like we talked about last week. Dr. Key, I know that there is a standing order in PA so that everyone has access to naloxone without a prescription. Which patients would you recommend naloxone to? And then also, what important counseling points would you want them to know when you dispense the naloxone?
Yes, thank you so much for that great introduction again about naloxone. And I think it's great here at Wilkes University. We do have our students, highly trained, and we put you out into the community to, help educate our patients about naloxone and the community about naloxone. So I think it's awesome in Pennsylvania that we do have that statewide standing order, and anyone can walk into a community pharmacy and get naloxone without a prescription. In some states, that's not the case. So I think that Pennsylvania has that is awesome and progressive and really sets us above some of the other states out there. For recommendations of naloxone, I do recommend to any patient that is getting an opioid. I know personally I've been on opioids after being in an accident, and I wish I was offered naloxone because I think it's important to have on hand, not only for myself, but for others. So if my pet or a child were to get into the medication, I would want to have naloxone on hand so that I can make sure if, a situation did happen and they were to overdose on a medication, that I could give them naloxone and save their life. So I think not only thinking about ourselves with the medication, but also thinking about others. Since I was new to utilizing opioids in that situation, I don't know how I would react. So being able to have naloxone on hand in case I was having any breathing concerns or were to experience an overdose would have been really helpful. So I do recommend it to all patients getting an opioid, whether you've getting an opioid for the first time or whether you've been on an opioid for a long time, because you never know what's going to happen.
Right.
I think when you were taught about naloxone, Dr. Franco probably talked about, wearing a seatbelt. So going into a car, whenever you drive, why do we put on a seatbelt?
So that if I got in an accident, I wouldn't get hurt.
Yeah, exactly. So it's just a safety precaution, right? We're putting on our seatbelt in case we get in an accident, we don't get hurt. We're not planning to get in an accident, hopefully not planning to get in an accident. But naloxone's kind of that same theory, just having it on hand is that safety precaution. So I have an opioid, having naloxone is like putting that seatbelt when I'm getting in the car. I don't plan to get in an accident, but if I get in an accident, that seatbelt is going to keep me safe. Same with naloxone. I don't plan on having an overdose. I don't plan on my child or pet getting into my medication, but if it happens, I have naloxone on hand to be safe. So I think messaging naloxone around that safety aspect really helps with getting patient buy-in for picking it up. I know in the past when I've tried to encourage patients to get naloxone, they've sometimes been a little hesitant, again, around that stigma, if I'm getting naloxone, then I'm taking too much opioid and people think that I'm going to overdose on the opioid. But that's not the situation. I think just having it on hand, not only for yourself, but for others is just essential for that safety.
Yeah, thank you for that insight in that story, Dr. Keek. And like you said with the stigma, I think it's really important to teach patients that it's not just for people with opioid use disorder, but it's for everyone. And it really keeps people safe and saves lives. So last week, we also briefly discussed buprenorphine, which is a medication for opioid use disorder. Buprenorphine is a partial agonist, which in Dr. Franco's words, satisfies receptors without the risk of an overdose. This helps people who want to quit using drugs and helps manage their withdrawal symptoms. Buprenorphine greatly increases the likelihood someone will stop using drugs and reduces the chance of an overdose. If you want to be prescribed buprenorphine, SAMHSA's website, samhsa.gov, has a buprenorphine finder to help find doctors that could prescribe it. So, Dr. Keek, how would you counsel someone with a new buprenorphine prescription? And also, do you know if you have any resources in your pharmacy for people seeking additional treatment for substance use disorders?
Yeah, great question. So I really love how Dr. Franco described buprenorphine as satisfying the receptors without that risk of overdose. I think that's a great way of really understanding what's going on with buprenorphine. And one other thing I like to think about when trying to compare this medication to is also patients who might be smokers. We have nicotine replacement therapy that we would give them when they're trying to quit smoking. So buprenorphine is kind of similar to that if a patient has an opioid use disorder and we're trying to help them with stopping to use those opioids. So it's going to, act on those receptors. It's going to prevent any of those withdrawal symptoms, and it's going to help satisfy any cravings that they're having, but it doesn't have that risk of overdose, and it really allows them to get off of the medication. So I think describing that to patients can be really helpful, and having that other comparison where there's not as much stigma around smoking cigarettes. So being able to kind of explain that it is a similar, mechanism that we're utilizing for this, and also a similar disease state. So smoking cigarettes, you get addicted to them. That's why we need nicotine to help with getting you off of cigarettes. So using nicotine replacement, same here. If you are utilizing opioids and have an opioid use disorder, using buprenorphine as that bridge to get you off of the opioids and help you with your recovery. So I think describing it that way can be really helpful for patients. One other big counseling point that I always make sure to tell them too is while they are utilizing buprenorphine, they don't want to utilize any other opioids while on this treatment. So it's really important that they're educated on that, and they're educated to tell their other doctors or providers that they might be on this medication, especially if they might end up in the hospital or have an injury. They need to let them know that they're on this other medication as well. I'm not sure if I answered all of the questions. What was the last question you had for me, Bryce?
Oh, no worries. I was just asking if you have any additional resources in your pharmacy for people seeking treatment for their substance use disorder.
Yeah. So I feel like in our pharmacy, we could be doing a little bit of a better job with this. And I think coming to this radio show and being able to talk about some of these things is really highlighting some areas for improvement, even in my pharmacy. I love that you talked about SAMHSA. Is that what?
Yeah.
Maybe we got to cut that over.
Okay.
I love that we talked about SAMHSA. And I try to have pamphlets to, have an idea of what providers are in my area that I can refer patients to. So I know that I've actually even texted Dr. Franco and tried to see, what providers might be taking patients currently in my area. So as a community pharmacist, having those resources, having an understanding of who is available in your area to refer patients to is really helpful. Also, being able to refer patients to Narcotics Anonymous or other community resources is definitely something that we should be doing in the community setting as pharmacists, for sure.
Thanks, Dr. Keek. I really like that smoking analogy with buprenorphine, and I'll definitely use that in the future. So like Bryce mentioned and Dr. Keek, we want to reiterate that SAMHSA has a treatment finder to help find treatment centers and providers near you. And they're also a great resource for you if you are suffering from substance use disorder and want to seek treatment, or if you know a friend or family member to help you with some resources as well. So Dr. Keek, how would you identify someone in your community pharmacy who might need some help and resources?
Great question. So I think the biggest thing is just starting those conversations with your patients. even if they're not coming in to pick up an opioid or not coming in, to get needles through your Safe Needle program, you can just have conversations with patients about the medications they're taking, asking them what concerns they have, developing those relationships. I think that's been my most effective way for identifying patients that might need help. So I know I do a lot of comprehensive medication reviews and talk to patients about the medications that they're taking in detail and really try to build relationships long term. And that's when patients open up and start to tell me things, and I can really dig into their history and figure out what is the best way to help them. So I guess that would be my biggest suggestion when trying to identify patients that might need help for an opioid use disorder, is building the relationship, getting them talking, getting them comfortable with you, because that's going to allow you to really figure out how you can help them in the best way.
Yeah, thank you for that, Dr. Keek. I think that's a really good idea, and just in general, building relationships with your patients is a good thing.
Yeah, and then finding the resources, like reaching out to colleagues and making sure you know what's available near you so that you can give patients, like, where they live, they can get specific treatment. So we're going to take a quick break. When we come back, we're going to talk a little bit more about harm reduction strategies. Thank you for listening to Generation RX Radio. Keep it locked on 90.7 WCLH until we return. Welcome back. You are listening to 90.7 WCLH, Wilkes-Barre, Scranton, Hazleton. For those of you just joining us, you are listening to Generation RX Radio. My name is Jamie. With us, we have Dr. Keek, Associate Professor of Pharmacy Practice, and my co-chair, Bryce. Before we move on, Bryce, could you give us a quick recap of the first half of our show?
Yeah, of course, Jamie. So today we're talking about some harm reduction strategies. So we were really highlighting how important it is to have clean needle programs, naloxone in your pharmacy, and dispensing naloxone to as many patients as possible. We were also talking a little bit about buprenorphine and why that's important. And finally, we ended the first half with talking a little bit about having those resources available in the community pharmacy, and also why it's important to talk to your patients and build those relationships with them.
Thanks, Bryce. So we are here to bring you weekly topics centered around the opioid crisis. Be sure to tune in every Wednesday afternoon from 1 to 1:30 p.m. for a new show. We are representing Generation RX, an initiative through the American Pharmacists Association, Academy of Student Pharmacists chapter here at Wilkes University, with the goal of educating everyone on proper medication use, medication disposal, substance misuse, and so many other topics.
Yep, so I wanted to go back to stigmas. So Dr. Keek, I know we talked a little bit about this in the first half, and I know a lot of people might be hesitant to carry naloxone or get prescribed buprenorphine even if they need it because of the stigma associated with them. However, like we talked about, these are some life-saving drugs that we want in the hands of patients. So could you talk a little bit about what pharmacists could do to make patients more comfortable with these medications?
Yeah, great question. And like we talked about earlier, I think the stigma around opioid use disorder is really a big concern, and it deters a lot of patients from getting these life-saving treatments. So I think, first off, whoever's listening to this radio station right now, taking that first step is you're educating yourself. So, educating yourself about the disease state, about the condition, is going to help with decreasing that stigma. I think, putting that message out there to the community and trying to educate as many people as possible about opioid use disorder and the fact that opioid use disorder is a disease state, like I mentioned, like having diabetes, having hypertension, is really important because it will help patients become more comfortable with seeking help and seeking treatment for these conditions. I know from practice, and this is one thing that I really encourage from my students as well, is being very empathetic with patients whenever they're telling you their concerns or coming in for a prescription and you're counseling them. So that is one of the first things I do to try and, build that relationship with my patients, try and kind of break that stigma, get them comfortable so I can talk to them about why these medications are important and why they're life-saving, why I am recommending them for that specific patient. So I think that would be those first two areas is first, become educated. Next, be empathetic with anyone that has this condition and being understanding. They might not be willing to pick up naloxone the first time that you educate them on naloxone, but following up, continuing to show that you care about them as a person, you have concern for what's going on in their life. That has helped me with actually getting patients more receptive to picking up naloxone and, trying to learn more about their condition, breaking that stigma. So I think that is the most important thing, talking about it, getting educated, and really trying to make sure that we are caring for people that have this condition and this disease state, because again, it is a disease state and it is okay, and we can help them and get them the treatment that they need.
Yeah, thank you for that, Dr. Keek. And
Yeah, those are some great points. I think education is really important. And then, like you said, empathy. Me and Bryce are still becoming pharmacists, but we definitely got into it to help people, and we really do care about our patients. So we're going to start wrapping up the show for this week. We just wanted to give a big thank you to Dr. Keek for being on the show this week and for your insight on this really important topic. Since we talked about so much, could you just give everyone a couple take-home points for this week?
Yeah. So be empathetic with anyone that you're talking to that might have an opioid use disorder. Get yourself educated. Learn about, how to counsel on naloxone. If you are a healthcare provider, get comfortable about what buprenorphine is. Also, make sure that you have access to the resources that are available to your patients or available to anyone in your community. So having an information sheet about maybe doctors in the area that you could refer someone to if you are a healthcare provider, or if you're just a community member, having that knowledge that you can refer someone to their community pharmacy to pick up naloxone or to get syringes and needles that are clean and safe for them to use. So those would be some of the takeaway points I'd want you to get from this presentation, and just, try to break that stigma. I've said it like 5 times probably already, but opioid use disorder is a disease state, and I feel like that is one of the most difficult things for some people to, wrap their head around, because it hasn't been looked at that way in the media and some other outlets. So I think trying to understand that and really relate to people that have that condition is important.
Yeah, that was a great recap, Dr. Keek. So tune in next week, Wednesday, December 22nd, from 1 to 1:30 p.m. to hear about stigma reduction, and as Dr. Keek mentioned a few times today, how addiction is a disease versus a choice. Thank you for listening to Generation RX Radio with Bryce, Jamie, and Dr. Keek. Until next week, keep it locked right here on 90.7 WCLH.